sit down.
I know, I'm just going to stand up here for. Well, good morning, everyone. Bonjour, Quay. I always hate to interrupt all of this conversation that's going on at these breakfasts, but I think we should get started. My name is Cheryl Jensen. I'm the president and CEO of Algonquin College and your host for today's breakfast. And I'd like to just pause for a moment to acknowledge that today's event is taking place on the traditional unceded territory of the Algonquin people. I would also like to welcome you and thank you all for joining us this morning for our Future of Health and Wellness Speaker Series event. Algonquin College is so very pleased to be partnering with the Champlain Lynn hosting this speaker series. And it's helped us to share ideas, spark conversations and discussions and have discussion on matters of relevance to the future of health and wellness across our community. I'd like to acknowledge the presence of John Fraser, MPP for Ottawa South and the interim leader of the Ontario Liberal Party for joining us this morning, a member of the Standing Committee on Estimates and critic for Health and Long-Term Care, Intergovernmental Affairs, Agriculture, Food, and Rural Affairs. I don't know how you spend time with those cute little grandkids there, John. MPP Fraser is a frequent participant at these breakfasts, and we're so grateful for your support, John. I'd also like to offer a special welcome to Jay McLaren from the Algonquin College Board of Governors. We also have our Student Association Director here, Michael Wolf. I saw Michael earlier. Thank you for being here. And from our Algonquin College Foundation Board of Directors, Ashley Brambles and Jeff Turner are here. I'd also like to take a moment at this time to welcome our online viewers joining us via web streaming. And for those of you on Twitter, the hashtag for this speaker series is hashtag ACLHIN, ACLIN, and hashtag OnHealth. These hashtags are listed on the tent cards on your tables, so please participate. And we'll hope you keep the conversation going during the breakfast, but as you think about what you hear today and in the coming days. For those of you who have never been here at our previous events, I'd like to point out to you that this restaurant is actually a classroom for our culinary students. And now that you've tasted their work, I think you'll agree with me that they're receiving a fine education here at Algonquin College. It's hard for me to believe, Chantal, I don't know about you, but this is our 17th installment of this series. How did that happen? Those of you who are returning know the caliber of our speakers, and as always, we've had an outstanding morning planned for you. And today is no different. I'm really looking forward to hearing from our guest, and I know that all of you are too. And so now, without further delay, I'd like to invite my good friend Chantal Leclerc, CEO of the Champlain Lynn, to please come forward and say a few words to welcome our distinguished speaker. Chantal.
Thank you so much, Cheryl. Good morning. Bonjour, Quay, bonjour. Thank you. Thank you for being here. And Cheryl, you're right, 17 now. I remember when Cheryl called me to say, you know, you think we could do something together, maybe get people out, talk about healthcare, talk about wellness, talk about health. I said, okay, we'll see where this thing goes. So it's just grown and grown and grown. It's pretty amazing. I'm glad to be here with you this morning. Jean-Pierre Boisclair, chair of the Lynn Board, is also here. A couple of our board members, Nick Busing, Barbara Folds, who wears two hats. We won't ask you who you're representing today. She's got our Algonquin College lanyard, but we need to get her a Lynn pin too. A couple of the Lynn staff are here as well, so good morning. We're pleased to be here. I am very excited about today's talk. I have the pleasure of knowing our guest speaker. But you know, we've come at this topic of health and wellness and the health of our community from many, many different angles. We've had amazing speakers, all of them coming at it from a different approach that has provoked our thinking. Actually, I'm just looking at Stephanie as well and Roger, who are on the Lynn's Patient and Family Advisory Committee. Pleased to see you here this morning, and the topic is so appropriate to what they're doing with us. We are going to be talking about how patients and families are involved in healthcare. And all of us in this room would say that we're patient-centered. All of us. We've got the values on our walls, the declarations, all of that kind of stuff. We put it in our vision, in our missions, in our mandate. But really, we're not always. Truly, if we were patient and family-centered, probably the first talk we would have had in this series would be from that perspective. It's only taken us 17, Drury. But we're getting it. It's interesting. I went to McGill for my nursing degree, and the McGill model of nursing, for those of you know, was all about being patient-centered. It was drilled into our head. You had to come up with patient and family goals, and if they weren't written from the perspective of the patient, you had to go back and do it again. Well, 25 years later plus, we're still talking about that and still trying to get people to understand the value of having patients and families involved from the get-go in everything that has to do with their own healthcare and the healthcare of others. So we're absolutely delighted to have our leading expert in patient and family engagement, who is Julie Drury. And she's the very first, the inaugural chair of the Minister's Patient and Family Advisory Council for the Ontario Ministry of Health and Long-Term Care. And I'm always proud to say that I was part of the panel that helped to find her and select her. So Julie is passionate about the patient, family, and professional partnership and experience in health. And in her role, she facilitates and provides the patient and family perspective in healthcare policy and decision-making, not an easy task. And as the mother of a child who was diagnosed with SIFD, which is a rare form of mitochondrial disease, Julie has particular experience in system navigation, complex care, care coordination, palliative care, and patient safety. She's an experienced senior federal health policy advisor and is respected for her highly collaborative work style, stakeholder engagement, and leadership skills. Her personal and professional experience is focused on advising government on key health priorities that have a real impact on patient care and experience in Ontario. Julie is a patient advisor. She's also a chair, board member with a number of organizations, and there was way too many to list here. I don't know how you do all that you do. As a patient and family advisor, she consults and speaks to organizations, government, and not-for-profits regularly on patient engagement strategies, patient partnership, and patient leadership. And we're so pleased that she's here with us this morning to share her expertise with us. So please join me in welcoming Julie Drury.
Well, good morning, and thank you for that introduction. And I'm more than happy to be the 17th speaker in this series. And this is great, and I've been attending this series since the fall when I first learned and heard about it, and saw Andre Picard was speaking in September and was like, oh, starstruck, I'm going to go see Andre. And then my good friend Bill Chernowski was here talking to you about digital health in the fall as well. And then Dr. Devlin was here this past December, and grateful to him to get a shout out as well about how he was going to be engaging and partnering with patients and families. So again, very pleased to be here. I want to talk to you this morning about patient engagement. And as soon as I've said that, I actually want to talk to you about partnership, because patients are truly already engaged in the healthcare system. And this is really about partnering with patients and families and bringing in that lived experience, that experiential evidence that patients and families carry into the healthcare system conversations that we're having right now, and really helping to transform the discussions that we're having, the deliberations we're having, but also how we're structuring our healthcare system so it's the most effective and efficient system possible in this province. I want to ask you for a moment this is an unusual picture to put up, but I want to ask you for a moment to picture a fender bender at an intersection. And a police officer arrives on scene, and he walks over to the burgundy car, and he talks to the driver and to the occupants, and he asks them what happened. What was the weather like? What were the road conditions like? Did you see that stop sign? Were you distracted in your driving? Do you have some ideas or suggestions or recommendations about what could be different with this roadway? Maybe we need a speed bump. Maybe we need better signage. Maybe we need a different speed limit. And he takes all his information and all of his notes. He puts together some really great quantitative information, some good data. He comes with some findings about perhaps what could be different and what happened at that scene. And then he leaves and files his report. And he doesn't talk to the driver in the burgundy car because he feels like he's gathered all the information. He doesn't need to talk to that driver. And that is the analogy that I want to give you about the healthcare system right now. We are talking to some incredible leaders, executives, CEOs, frontline providers, doctors, but we are not engaging as much with that burgundy car, which are the patients, the families, and the caregivers in the healthcare system. And that would never happen, right? In any other scenario, you would gather all the information. You talk to both of those car occupants. You would make sure that you had a really good and fulsome picture of what had occurred. And so this is where I hope we can drive towards in the healthcare system in Ontario. You know, patients and families spend hundreds of hours managing their care in the healthcare system. A slice of that, a small portion of that, is where they're engaged with the healthcare system in conversations with their healthcare providers, or perhaps in hospitalizations, or perhaps in home care. But they spend at least, on average, 2 hours a day managing their care and trying to navigate the system. They are already engaged. They might not have the knowledge and the skills yet, and I think that's one of the things that's perhaps lacking in our healthcare system, is augmenting that health literacy and helping patients to learn how to self-manage and how to navigate the system the way we've structured a little bit better. Caregivers are also very engaged. 11 years ago, I was carrying on with my life. I had a young son, a 3-year-old, and I was pregnant with my daughter, Kate. And I thought I knew about the healthcare system. We had engaged with our family doctor. I'd been to CHEO with my young son for pneumonia. You know, we'd had some very periodic hospitalizations. Until I was dropped, literally, into the healthcare system with Kate with a rare undiagnosed disease at the time. I literally had no idea. I didn't understand that our system is not seamless. It's not integrated. There is really, truly no care coordination. And we were very fortunate that our care coordination became better supported over our journey because of an initiative here that was very specific to our region and to the needs of our community, which was the Champlain-Lynn Complex Care Program. And so there are opportunities in the system to facilitate and enhance that systemic care and that better care coordination. But truly right now, it is not seamless, and there are only small pockets of it where it's working for patients and families. Patients and families truly are engaged. Our healthcare system right now across Canada has a multi-billion-dollar unpaid healthcare workforce. And that's the patients and families who are at bedside with their loved ones, or sitting in palliative care hospices, or sitting in hospitals at bedside. And I'm sorry, I have to glance over at Stephanie Paravan, who's the chair of the Lynn Patient Family Advisory Council, co-chair, along with her co-chair, Anita Manley, who is helping you understand better how the healthcare system works and how it's organized and how it's working for patients and families, and offering the Lynn that advice and that feedback. And at the same time, a full-time 24/7 care coordinator for her medically fragile son, who's currently at Roger Nielsen House. Those are the types of experiences that patients and families, the richness of information that they're bringing to the healthcare system. They are managing care in homes. They are working IV pumps. They are doing wound management. They are doing basic nursing duties. And they're not just doing it in home care alone. They're also doing it in hospital at bedside, because we've got a reduction in staffing. We have patients and families who are making sure that their loved ones are turned regularly. They're advocating for them during rounds. They're making sure that they're not experiencing harm in care. They are there making sure that medications that are being administered are the right ones. I myself caught 2 different medication errors in one day with Kate. And that's not to say that's not our role, and that isn't important, and it's not pointing finger or blame at anyone in the healthcare system. But I think what it's showing and demonstrating is that there is significant value in talking to patients and families about their experiences and what those challenges and barriers are, and what's working and what's not working. So patients and families, we're already engaged. What we want to do is partner with you. We want to talk to you about how the healthcare system is designed, how it's structured, what you're working towards as healthcare leadership communities in terms of trying to make it better and more coordinated, more seamless. You know, patients and families are the ultimate hackers of the healthcare system. We congregate with one another and we talk about, you know, who's the right doctor, where's the right place to find care. You know what, don't call this person, call that person, you'll find it more easily. You know what, you're stuck in Toronto at Sick Kids and we need to get you back to Ottawa. I know someone that you can talk to. And sorry, I keep looking at Stephanie because that was partly of how our relationship formed, is we coached one another about how to find the best access to care. We are experts at hacking the healthcare system. So wouldn't it be interesting, rather than structuring that beautiful pathway with the really great gates and the really shiny objects around it, to look at how patients and families are truly navigating and to look at those paths that they're making in the healthcare system on their own and to learn from that. And to think about how could that be applied to how we've currently structured the healthcare system. What could be the shift or the change? It's creative thinking, it's disruptive thinking, it's hacking the healthcare system to actually make it more patient-centered, to really live it as a patient-centered system. So where have we been? I am watching a CBC television series right now called Unspeakable. Has anybody else seen it? A few people have seen it. Unspeakable is a documentary right now about the experience of persons who were hemophiliacs in the 1980s who were affected by the tainted blood scandal. And one of my council members was caught up in that tainted blood scandal. He was infected as a young child. He was not told that he was infected with HIV and with Hep C until he was 18. The information was available in his health record when he was 15. And no one made him aware. And he didn't have access to his health record, and we still have poor access to our health information. But those hemophiliacs banded together, and they were the disruptors in the system. They are the ones who affected change. Yes, there were journalists involved and doctors involved and you know, persons in authority, but it was the persons with the lived experience who were living that tainted blood scandal that brought that disruption to the system and affected change. And I invite you to watch Unspeakable, and you can stream it as well, but it's pretty powerful and pretty incredible. And it speaks to the experience of patients and families of feeling that frustration of speaking up, but not necessarily being heard. We share our experiences regularly. We do patient storytelling. I've done it over the 11 years of my role as a patient family advisor. I've come up and I've shared Kate's story in depth. And then I've gone away and thought, I've just given a piece of myself, a piece of my soul, a piece of my heart, and I'm not really sure what impact it had. And so I'm actually a very strong champion right now for patient storytelling at the Ministry of Health and Long-Term Care, and I bring patient stories regularly to the senior leadership team, Chantal and her colleagues of the LIN CEOs, but as well as the assistant deputy ministers and deputy of the ministry. And when I bring those patient stories, I set a challenge for everyone in the room. Hear the story, listen to the story, think about how that story could affect change in the systems that you currently have structured in your organizations. Ask questions. Let's have a dialogue. Let's consider what the storyteller is telling you, and not to say, oh, that's a really hard story and that's probably a one-off story and we really can't change that for that patient. The patients are the canaries in the coal mine. For every one story, there are hundreds that follow. And so we've really championed patient storytelling at the ministry to really be a dialogue and to really be deliberative, and also to provide feedback to our storytellers about what was heard and what change might have occurred as a result of the stories that were told. The other thing that our patients and families do regularly is we provide advice. We fill out endless experience surveys. In fact, I actually wrote Chio once after several years of receiving multiple experience surveys about my inpatient visits, my ambulatory care visits, my ICU visit, and et cetera, and I said, please stop sending me surveys because I have no idea what you're doing with them. And I was actually really into these surveys. I was like writing down the piece of paper, and then I'd get out the laptop because there wasn't enough room in that section for me to say what I wanted to say, and I thought I was really providing amazing input. And I would mail them off because it was snail mail, it wasn't email. I'm sure their technology has changed in recent years. But I had no feedback. Where did that information go? Where did my story go? Where did my advice and feedback go? What change did it affect in the system? There was no 360 communication loop. And so we have been there. That is the past. of patient engagement. And if you're still doing that in your healthcare systems right now and in your organizations, you need to change that. You need to shift how you're hearing patient stories. You need to hear the advocacy and the championing from patients and families. And you need to shift about how you're hearing and interpreting and also providing feedback on those patient experiences. We are going in a really unique direction right now, not just in Ontario, but across the country and internationally when it comes to patient and family engagement. We're involved in policy. We're involved in health system design. We're involved in patient safety and quality improvement. It's rare now that an organization does not have a patient or family member on their quality improvement committees. It is rare for a patient to be involved in patient safety, but it is happening. Traditionally in patient safety, when we do investigations around adverse events or harm or poor outcomes or death, that is something where the hospitals will mobilize the wagons and they will get their directors of patient safety and they'll go off and do an investigation. When we experienced harm, I advocated and we were finally invited into the conversation. And because of our participation in a patient safety review, there were 30 policy and program changes to the hospital where my daughter was cared for. There is opportunity there. There is richness in there if we're willing to have those uncomfortable and challenging conversations. Patients are involved in research. The Canadian Institute of Health Research, CIHR, has SPORE, unfortunate acronym, the Strategy for Patient-Oriented Research. I just picture spores of like mushrooming, and it really is unfortunate. It's Kim Barnhart here. She's the communications director. She's supposed to be here this morning. She should change that. Anyway, we really are involved in research. We are involved in dialogues about what research should be happening, right? What is of interest to patients and families? What's going to be the most value and impact in the research community? We're very involved in knowledge translation. I'm working with 2 different organizations right now from across the country, one around alternate levels of care, and the other around pain management for pediatrics. And there is really rich research there, but the knowledge translation historically has taken 17 years. Can you imagine? 17 years for knowledge translation to occur. So they're looking at how to partner with patients to change that curve and to shorten it, and so that patients and families get better access to research information in a more timely way, and they can use it in their care. We're working on data. ICE right now is starting a patient and family advisory council so that we can talk about how our data and our information is being used. I wonder often if I had had unfettered access to my daughter's healthcare information, all of it, doctor's notes, lab results, diagnostic imaging, everything, in a timely way, not held back, but unfettered. And if I could have used that data information and mobilized it to send out to researchers and academics, I wonder if some of our decisions around her care might have changed. I also wonder how our data is being used and how it's being incentivized and how it's being sold and purchased. And those are some of the things I think we need to start thinking about in our healthcare system, but patients and families need to be included in that dialogue. We are moving into professional patient advisors. I guess maybe I'm a professional patient advisor. I don't know. I'm paid in this role to be perfectly open and transparent. And so we are looking to patients to lead on this. We have traditional patient engagement professionals working in organizations. Rarely are they former patients or families or caregivers. And we have those skill sets and we have those abilities, and many of us have been around for quite some time now and have seen all the different aspects and levels of patient engagement. And we're getting involved in medical health education. I'm really excited to be working on an initiative with one of our Ontario universities around medical education and patient-developed curriculum and led curriculum. And I won't say who, but it's really exciting to see that happening. University of Montreal has a Center for Excellence on Patient and Public Partnership. They have a completely developed, led, and delivered curriculum for their medical school from first years all the way through residency, done by patients and families and caregivers. And it is a requirement of their medical school and colleges. We're seeing increased uptake of patient partnership, not just regionally here across the Champlain-Lynn. Barnard is here, and I'm not sure if anyone here is from TOH, but I recently spoke to many of their patient family advisory councils. CHEO has what they say is the longest standing family advisory council in Canada right now. So we have Roger Nielsen House, Megan and Bruno have a very strong patient and family advisory council as well. We have significant patient engagement happening here regionally. Provincially, our provincial government, obviously the Minister's Patient and Family Advisory Council, and our federal government are working on palliative care frameworks, that have engaged patients and families and caregivers. Megan and I were very intimately involved in those conversations back in the spring. Dr. Hoskins is leading on a national pharmacare initiative. He doesn't have any round tables where he doesn't have at least 2 or 3 patients at every table for those national pharmacare dialogues. Really interesting approach and a very partnered approach. Our medical associations are getting into patient engagement. I was recently at policy consultations with the College of Physicians and Surgeons of Ontario around continuity of care. And they asked me to attend as a patient advisor, and I said, sure, but my rule is never 1, always 2, preferably 3 or more. So I made sure that we had at least 3 patients in that room of about 20 to talk about continuity of care policy and changes at the CPSO. The Canadian Medical Association, CMA, now has Patient Voice, a Patient and Family Advisory Council to the CMA, again, around their policy and initiatives. Leslie Thompson, former CEO of Kingston General Hospital, some of you might know her as a colleague, very powerful patient partnership advocate, now at the helm of Accreditation Canada, and integrating patients as partners into Accreditation Canada. If you're going to be accredited, expect to have patient surveyors show up on your campus, because that's what Leslie has introduced. Patients are partnering in the accreditation process. They are also part of the Health Standards Organization and are working on technical committees to develop health standards. And then national organizations, Canadian Patient Safety Institute, patients and families heavily embedded into their role. The Canadian Foundation for Health Improvement, they don't do any collaborative work across the country unless they're partnering with patients and families, and they also coach on how to partner with patients and families with the organizations that they're working with and help to foster the development of patient partnership across the country. And of course, CFHI, as I mentioned before. So we're seeing change. But there is a skill set to this. It's not something where you guys are going to leave the room today and say, oh my gosh, Julie was amazing. I'm so inspired. I'm going to go home. I'm going to start a PFAC. And a PFAC is a Patient Family Advisory Council. It's really not the way to do it. You need to really think about your organizational readiness to do this. You need to think about the buy-in from your leadership, from your senior leadership, from your CEOs, all the way down to your directors, managers, and frontline staff, and the people that are working directly with patients and families. This needs to be embedded into the culture of your organization, into your values, your mission. It needs to be part of every question that you have at every part of the day around the work that you're doing. How would the work that I'm doing right now, how would what I'm writing right now in this email, how would the policy that I'm developing right now impact patients, families, and caregivers? How would they live this? How would they experience this? And then you need to think about how you want to partner with patients. What are you ready for? Are you ready for a focus group? Are you ready to have a patient on your steering committee? Are you ready to bring on a broader patient and family advisory council that is embedded in your organization? And let me caution you on that. What typically happens with PFACs is we form them, we bring them together, it's really great, we sit them over here, and then we go to them and we show things to them. What do you think of this? And the PFAC might be okay with that for round 2, round 3, round 4, but eventually they're going to start to be a little bit pissed off. And they're going to say, we actually want to be part of it. We want you to come to us early. We want you to come to us often. If you're going to talk to us about your strategic plan, don't come and present your strategic plan. Get us involved in the process. And so there's a lot of organizational thinking about how you're going to engage and partner with patients and families. And similarly, from the patient partnership point of view, they have to have readiness as well. There is a lot of unfortunate experiences in the healthcare system, and there are a lot of great experiences. I would not have been ready for this role 3-4 years ago, right after my daughter died. My daughter experienced harm in the system, and I was angry, really angry, and I wouldn't have been ready. I could share her story a little bit, but I wouldn't have been ready to offer this kind of level of consultation and advice, and quite frankly, frustration sometimes, having gone through 3 ministers and 2 governments in the first 8 months of an inaugural role, but that's an aside. That's an aside. I love my job. You need to make sure your patients are ready. And it's not to say that their input and feedback at any point along their healthcare journey is not important, but if they're going to be involved with your organization as patient and family advisors, they need to have that level of competency of being ready to communicate, being ready to get out of their own lived experience and see a broader picture of the healthcare system, being able to advocate and advise on other patient and family experiences that they're seeing and that they've learned about across the healthcare system. They need to be able to be active listeners and engaged listeners, and they need to be able to okay with different opinions around the table. They also need to be persistent. and they need to be what I call gently fierce. So there is a style and a level of communication skill set to patient engagement, and it's not suited for everybody. But that's not to say that we don't want diversity and we don't want a lot of different interaction with patients and families. So think of the mosaic of patient engagement. There are layers to it. The surveys are great. I kind of made fun of them earlier, but they're still great. They're a great tool. Just make sure you're using them properly and you're offering feedback. Focus groups are great. Phone calls are great. Questionnaires are fine. Bringing patients into collaborative conversations that are short-term are great. There are all different types of ways to do this patient engagement and partnership piece. I'm just going to give you a moment. Do you see it? I'm sure there was a really well-designed working group that thought this through and sat around and had a lot of really deliberate discussion about where should that toilet paper roll go. And I'm just wondering if they asked the user. So effective patient engagement and partnership, early and often, 360 communication. What are you hearing? How are you going to use it or not use it? And it's okay if you can't use it, but you can maybe put a pin in it, or you can let the patient and family community know that's not going to work and here's why. And maybe you'll open up another form of conversation, but you've got to have that 360. You can't be asking for their opinion over and over and over again and not let them know how it's being used. Using appropriate patient engagement paradigms. I like the Carmen framework, so you can Google Carmen framework. I probably should have had a slide to show it to you, but it's a really great, effective patient engagement framework that brings you from feedback and advisory role all the way towards deliberation, collaboration, and co-design. You can also look at IAP2, which is a patient and public partnership model as well. So there's all kinds of models out there, all kinds of ways to frame this. You do not need to overcomplicate it. You need leadership. You need people like Chantal Leclerc, Megan Wright, Bernard Leduc. I don't see him. I know he's in the room. There he is. Oh, God, he's right in front of me. You need people. When I first went in to speak to the Patient and Family Advisory Council at the Montfort, I had this really great deck, and I was going to talk to him about the value of patient engagement and what you guys should be doing. And Bernard's like, we don't talk about patient engagement here. These are partners. We're about patient partnership. And I was like, oh. Just throw it that deck. Why don't we just have a conversation? And they were already there, right? And so that's the kind of leadership you need, and you need to really ingrain that into your culture. And it's not an easy task. I'm sure Chantal's nodding here. It's not an easy thing to drive that down through your organization and the conversations that you're having. But that's why people like that are in place to drive that leadership. Oops, sorry. So what is happening in Ontario? I'm really excited about what's happening in Ontario, and I actually wrote myself a list. In Ontario right now, over the past 18 months, we've been developing not only the role of the Minister's Patient and Family Advisory Council, but also the role of patient and family advisors across the province. So, and I realize I'm over time, Cheryl, so I'm going to just go 5 more minutes. We have a virtual pool of patient and family advisors of over 700 people from across the province that are advising the ministry on policy and programs and initiatives. And we've opened that virtual pool as well to the Premier's Council on Health and Hallway Medicine. So Ruben has been able to dive into that pool of patient advisors as well and get their advice on the work that he's doing. Our minister's PFAC meets regularly with senior leadership from across the ministry. My role is direct communication with Deputy Angus and with Minister Elliott, and I meet with Deputy Angus regularly, weekly in fact, to talk about policy and programs that are emerging and evolving across the Ministry of Health. And we truly are in a time of change. There's no doubt. There's no secret in this room that change is coming across the healthcare system. And I'm privileged. I really am privileged to be in that role, to be able to provide the advice and the insight on behalf of patients and families. There were some murmurings back in the fall of, you know what, Julie, your role is not going to be around for much longer. They're going to get you out of there. You were a Liberal government appointee. I am not affiliated with any political party. My role is to represent the voice of patients and families and to represent our perspective. And I see great value in that, and I'm really pleased that our current government, as well as our past government, sees the great value in that as well. For those of you here last month, you possibly heard Dr. Devlin's presentation, and you heard him talk about how he's working with the Minister's Patient and Family Advisory Council. He actually met with our council last Friday, and I'll be going to meet with his council on the 28th on Monday. And so there is that synergy happening. And so although there is not a patient on the Premier's Council on Health and Hallway Medicine, which I feel should happen, there is good patient and family engagement and partnership happening, and we're driving that forward. We have 14 regional LHIN patient and family advisory councils across Ontario. There are 10 to 14 members each, approximately 160 people across the province working on patient engagement and partnership. And in addition to that, many LHINs are engaging patients and families even further across the organization. So we're talking about several hundred people regionally that are focused on the regional priorities and what the needs are in their communities and what's working in their communities. And I think we want to make sure that we hold that value as we move forward in this healthcare system transformation. This can't sort of be a block of what's good for Ontario. It really needs to be specific to our communities and our patients and families in rural communities and urban communities and remote communities and those that have to travel distance and interprovincially to receive care really need to have a voice in that system transformation. We've established the provincial PFAC leadership table, which is composed of all the chairs and co-chairs of the patient and family advisory councils across the province, including Health Quality Ontario and Cancer Care Ontario. And so we meet regularly and have regular conversations about what's happening, best practices, sharing information, and talking about our reach as patient and family advisors. And very soon I'm going to be sharing the Patient Declaration of Values for Ontario. And this is a document that was developed by the Minister's Council, by my council, but also in consultation with that virtual pool. We had over 180 people reply to the Declaration of Values piece. It's specified 5 themes of expectations that patients and families have of the healthcare system. And these are aspirational expectations of how the healthcare system needs to be supporting patients and families, but also working with them. And those themes are respect and dignity, empathy and compassion, accountability, transparency, and equity and engagement. And so I'm excited to be sharing those soon, hopefully in the next couple of weeks. So we're moving the marker on patient engagement in Ontario. I'm convening a table at the end of the month of March in collaboration with the research and evaluation team at the Ministry of Health to talk about the evaluation and the impact of patient engagement. There are many people working on this in the province. Julia Abelson out of Toronto, Anna Gagliardi, Umar Majid. There are many people working on how do we measure the return on investment around patient engagement. And I think that's something that's very important, especially in our time of fiscal restraint and really looking on return on investment right now. And so why not bring together everybody in the room who's working on this and figure out some strategies together. So I'm excited to be doing that and to be hopefully sharing that with our regional LHIN PFACs and our organizational PFACs as we move forward. And just briefly, our Minister's Patient and Family Advisory Council, those priorities that you see on the left-hand side are the ones that we're going to be driving over the next 8 months. Mental health, integrated and coordinated care, and streamlining acute care. Bob Hale is here from our Minister's Patient and Family Advisory Council. He's with Kemptville Hospital as well. And we had a really robust conversation in October to talk about what is our path forward and how can we align ourselves with the new government as well as with the ministry. And so those are the 3 priorities that we're going to drive at in the next few months. On the right-hand side are priority areas that we've also had conversations about as a Minister's Patient and Family Advisory Council, and we're not losing sight of those around system navigation, access to information, digital health, and patient partnership. And so patients and families, we're truly drivers of change. We want to be part of the conversation. We want to work in partnership. We want you to engage us. We're engaged. We're there. We're at the ready. We want you to engage us and partner with us. So what I want to leave you with this morning is this question, and to take back to your organization. How would the work you do be changed if you partnered with a patient? Thank you.
Questions that don't get answered this morning. Yeah, go right ahead. We'll bring you a mic. Just a minute.
I think my voice will count.
It's for the folks who
Thank you very much for your very interesting talk and superb talk. I think you touched upon a lot of different points. I do have a question for you. So when you talk about readiness of organizations or patients, what would you mean by readiness? Or what's the one or two qualities that an organization needs to be ready, as well as on the patient or family side?
So readiness for organization, the number one for me is that you are ready to listen and to hear what patients and families have to say, and not only ready to listen and hear, but ready to determine or figure out how you can actually operationalize that within your organization. Readiness from the patient and family perspective is taking yourself out of your own lived experience. So we have tunnel vision around our lived experience, what happened to us in the healthcare system, the good, the bad, the ugly, but you need to broaden that perspective. It's not just about fixing perhaps your experience, but looking at it from a broader system perspective. Those would be the primaries for both.
Thank you very much for your presentation. It's a long time in coming, and I congratulate you for your efforts. It seems the efforts are very directed at the policymakers, at planners and funders. It's very much a macro approach to this. But the transaction that counts, in my mind, most importantly, is what happens day to day between clinicians and patients and their families. What are you doing at that policy level to incent clinicians to be much more supported in their efforts to improve their communications and so on? And I think of the example that we often hear in a fee-for-service system with physicians. They are incented to produce and not really spend the time, and particularly in a world where chronic disease management is becoming very, very important, there has to be a system in place that allows clinicians the time to properly deal with the intricacies and complexities of individual patients and their families in that regard. So what have you been able to do to create those incentives to change at the delivery level?
Yeah, it's a really great question and comment, and I absolutely agree. I think traditionally patient partnership, patient engagement has occurred at the organizational level, right? Hospitals and long-term care and home care, and now we're reaching into policy, which is why I focus that way, because that's my role right now at the ministry. But we are lacking on being able to partner with providers. And with all due respect to providers, they have a lot of autonomy in the system, and it's hard for patients to incent that. It's actually even hard for organizations to incent that. So I think working with the colleges, with the regulatory bodies, with organizations like the CMA, which is where we're getting traction as patient and family partners, and having those conversations. I'm truly excited about the movement into the schools of medicine to talk about communication styles and what that looks like, and what it means to have 360 communication with your patient, what it means to augment the health literacy of your patient, what it means to have shared decision making. We hear that term thrown around quite a bit. What does it actually mean to the patient? And so we're working on that and getting that traction in the middle schools. From the incent point of view, that's a tough one for me or for any patient advisor. We don't have a line of sight into that. That's really up to, government and OMA, I guess it is, to sort that out and to incent that. I'm hopeful that hospitals themselves can offer that leadership and can offer those policies, that suite of policies within their organizations to try and support those provider and patient relationships. And I think we've got strong leadership to that end here in Ottawa, at least locally, but if not provincially, I think we've got that leadership. So those are some of the ideas and suggestions, but it is it's unmined territory that we need to get into. We need to start having those conversations, and it's a tough one. I think providers have traditionally seen themselves as, I'm there for the patient, and I am their advocate, and I am their, their best support. And it is not a finger-pointing exercise at providers by any stretch of the imagination. It's just wanting to have more synergy and to equalize that partnership, to take it from this to this, and not to take anything away from that doctor's experience and their expertise, but to recognize that patient also has some really great lived experience to bring to that conversation. We need to make it easier for them. That's for sure. We're hearing so much about physician burnout right now, and you know how tight it is to have really great comprehensive conversations with our patients, and the time that you have dedicated to a one-to-one conversation with your patient, and that's some of the structuring around fees and how we deliver care. I think virtual care is going to open up some opportunities as well, to take the pressure off providers and to enable some better conversations with patients as well. And I could go on, lots of ideas, and it's a great conversation to have for sure. Yeah, thank you. Frank?
Well,
Sorry,
hi,
Chantal,
Julie.
now I'm managing the room. Frank?
No. Doing a great job managing the room. A great presentation as always. I've heard the presentation a few times, and I'm taking something different from each one that I participate in. It just occurred to me that, you know, we're spending a lot of time, and you're doing great work in Toronto and across the province, advising policymakers and clinicians. But I'm interested to hear a bit about what you're doing and the council's doing to help prepare, tool, and skill patients to be better partners themselves. Because I know it's very, very intimidating. I've done a little bit of patient advocacy work with my own family, and I'm not very good at it. I'm trying to be better. But if I had better skills and tools, and folks that may not be in the healthcare system may be very intimidated by this massive enterprise they're interfacing with. So it'd be interesting to hear if there's any efforts going on to, maybe it's a toolkit or a guide or just some tips and tricks so patients could be more comfortable engaging in this partnership or even forming a partnership, because it's quite daunting at the outset.
Yeah. So we are very fortunate in Ontario to have an organization called Health Quality Ontario. And HQO's role is just what you're describing. It is not the ministry's role to offer those types of training and structures and sort of educational programs, but it is Health Quality Ontario's role. And if you go onto their website, there are great resources there, both for the organization in how to set up patient engagement, perhaps a patient and family advisory council, some of the tips and tricks, some of the things that you're talking about, Frank, training and orientation about how to do that. There are also great resources there for the patient and family and caregiver advisors. One of the things that that occurred before all the LHINs brought on their patient and family advisory council, and is continuing to this day, is Health Quality Ontario offering coaching and training and education seminars to the LHINs, both to the patient engagement and leadership, so that people like Lise Rassicott and Elaine Medline, oh, she's still there, she's gone, oh, she's there, and helping them to understand how to bring on a patient and family advisory council and how to structure that. But they're also coming into the LHINs and they're working with the patient and family advisory councils themselves, with the patient partners, to help to educate and inform them about their role as patient and family advisors. So that education training resides there. Within the ministry itself, I have a really teeny tiny incredible team that work on providing education resources and training within the ministry to help the ministry policy and program areas understand what they're meant to be doing around partnering with patients. And then we also offer a significant amount of support to the patient advisors that we bring into the ministry, because it's a different level of thinking and it's a different level of engagement. So it's happening, but I would point you to Health Quality Ontario as sort of the best practice right now in the province. Welcome.
Thank you, Julie. Thank you.
You're welcome.
Julie, thank you so much for an incredibly interesting, informative topic. This is a complex topic. The more we talk about it, the more you can see the layers, but it's so important. Every time I hear you speak, I come away with 6 new ideas, and I also realize of all the stuff we're still doing wrong, and I'm looking at our Patient and Family Advisory Committee, right? Yeah. But we're learning, and I think that's the part that's important, is you have to start somewhere. We've been deliberate at the LHIN to not say, okay, let's bring patients and families in everywhere all the time, because I don't think we would be ready, and they would probably be very discouraged with us. So we're learning to walk before we can run. But this morning I was thinking about, I saw Paula Greco here, who's our evaluation specialist. Why don't we have patients and families working with Paula to figure out what are the topics we should be evaluating, right? And then how should we evaluate them? There's no reason why we wouldn't have patients and families part of designing our orientation. Like, we deliver home care services. Who best to say, this is what we think your staff need to know from the get-go, and maybe teaching some of that. So anyways, I've got 6 new ideas to bring back to my organization, and I'm sure you all do too. So Julie, thank you so much. You're so generous with your time and with your sharing your knowledge, and your passion is so obvious of wanting to make us all better at what we do, but truly by partnering with patients and families to get it right. I always say there is an economic imperative to doing this, right? It's not just the right moral thing to do. There's an economic imperative to partnering with patients and families. Organizations who do this well actually save money, right? They have fewer errors. They don't have to redo things 6 times because they got it wrong the first few times. So in times of, fiscal constraints and demand that's growing, we have to do this. We have to do this if we're going to sustain our healthcare system and do it better. So thank you. I thank you for being here. I'm going to hand it over to President Jensen, who's going to close us out for today.
Well, I'm always overwhelmed by our speakers at these events, and Julie, my own thanks to you. First of all, as a mother, and what you've gone through yourself and how you've turned that into a positive effect for all of Ontario. I wear a necklace around my neck that was given to me by a friend of mine who lost her son almost 3 decades ago. And so I know how hard it is to not only deal with that yourself, but then to share that experience and make a difference in Ontario. So much appreciated. Also, all the way through this entire presentation, I could have substituted students for patients. And so I know Laura Stambra, who's our Vice President of Student Services, and I will be talking about that. Michael Wolf, who's a student here and on our student association. We need to do more of that, Michael, and so I appreciate the thought leadership that you've given me for how we can make things better here for our students as well, and their families. So let's please keep this conversation going. I've told you about the hashtags for this event. Please participate in those and keep this conversation alive till our next breakfast. This brings us to the end of our agenda, but there's still lots of food, I think, and please stay if you can. I know many of you have to leave, but thanks for giving us your time today. Merci, miigwech.
I'm gonna head up, so I'm gonna try and meet with Colin Benang as soon as possible.
Okay, no, that's perfect. I'm just sticking around here. I'm gonna grab the photo.